In the third section, we would like to talk about the diagnosis of Graves' disease. Once hypothyroidism, especially Graves' disease, is suggested by the medical history and the manifestations, we need to know how to make the final diagnosis. Firstly, make sure it is thyrotoxicosis or not. It may be suspected based on signs and symptoms, and then confirmed with blood tests. If hypothyroidism is suspected, diagnosis is made through a blood test to measure TSH, free or total T3 and T4 levels in the blood. Especially TSH is the first-line marker indicating the presence of thyrotoxicosis. It is the most sensitive and earliest parameter for hypothyroidism. By sensitive assays, TSH should be undetectable or low in all patients with primary thyrotoxicosis, whereas serum T3 and T4 usually are high. The next step is to figure out what is the cause for thyrotoxicosis. Radioiodine uptake by the thyroid scan by ultrasound, and technetium-99 and blood TRAb test may help determine the cause. TRAb assay is very specific and sensitive for hypothyroid Graves' disease. Next step is to figure out what is the cause for thyrotoxicosis. Radioiodine uptake by the thyroid scan by ultrasound, and technetium-99 and the blood TRAb test may help determine the cause. TRAb assay is very specific and sensitive for hypothyroid Graves' disease. If it is positive in the blood test, the diagnosis of Graves' disease can be made in patients with thyrotoxicosis. To further differentiate the hypothyroidism from destructive thyroiditis, radioactive iodine uptake is recommended to be performed. In patients with Graves' disease, a high value is found after 24 hours of uptake, and in some cases, the value can be even higher before the 24th hour as a consequence of the rapid iodine turnover in the thyroid gland. However, it is very low in those patients with silent or subacute thyroiditis. Ultrasound scan can help find the nodule or adenoma in thyroid. Thyroid isotope scanning is useful when coexisting nodules are detected by palpation and their function states need to be evaluated. Using this scan, autonomous hyperfunctional nodule or adenoma could be found. How to make sure Graves' disease is the cause of hypothyroidism or make the final diagnosis of Graves' disease? Direct evidence support Graves' disease diagnosis is either diffuse or symmetric goiter, Graves' ophthalmopathy, peripheral myxedema, or TRAb positive in a hypothyroid patient. If there is no any direct evidence, other diseases who can cause thyrotoxicosis should be further excluded. Altogether, there are two main steps to diagnose Graves' disease. Firstly, thyrotoxicosis should be established based on increased serum T4 and T3 and decreased TSH level. Secondly, direct evidence for Graves' disease should be checked. If not found, other causes for thyrotoxicosis should be carefully excluded. That's it for this section. Thanks.